Hello everyone, I am here at Spruce MD Integrative Health with Dr. Blankenship, and I have just completed my DEXA scan, and there's so much valuable information here, and I know that you guys are going to have so many questions, so I just wanted to chat with you about why we should be even doing, what is a DEXA scan, and then what are the benefits of doing this in midlife?
Right, so DEXA scan is, what we have specifically for our DEXA scan here is a whole body DEXA scan. So you probably have heard of an osteoporosis screening DEXA scanner. So you're just looking at hip, you're just looking at spine. We have a whole body DEXA scanner, which is the only one in the upstate available to the public. And why it's important is you're looking at your whole body composition. So I tell patients, I don't care what your weight is, I don't care what your BMI is, because those are imperfect measures of health. The data we're getting from this actually is giving us a better picture of what your overall picture of health from a body composition looks like. I see lots of skinny patients, skinny fat patients, right? Because they're all fat, right? Like you don't have muscle, and if you don't have muscle, that's not healthy. So you ask about why it would be helpful during midlife. Well, so first of all, we're looking at your muscle mass. Muscle mass starts declining as we get older, and we start to see more sarcopenia. So if you don't have muscle mass going into older years, your older years of life, then you have less to lose, right? So you're gonna be more prone to injury, to falls, other things like that. The other thing is with the whole body DEXA scanner, we're getting bone mineral density for your whole body. So yes, we can do specific osteoporosis screening on our DEXA machine as well. Mm-hmm. But with the whole body, we're capturing that T-score and the Z-score, which are measures of osteoporosis. Not a screening measure or screening test. The whole body is not for osteoporosis, but we can look at those values. And if they're under a certain amount, we might recommend you go ahead and do a hip and spine DEXA scan to screen for osteoporosis. And it's interesting, we're catching more osteopenia, osteoporosis in women often. We've caught it in some men in younger ages, because typically it's not recommended that you do osteoporosis screening until age 65. So that's been a cool thing that I didn't even anticipate that we would see with us.
Yeah, and I wanted to do one because I wanted to check my body fat and also just get like I said, kind of a screening for where my bone density is, and to know am I doing the right things right now? Because when menopause hits, your bone density severely declines, and it's silent, so you don't really know you have it until you get screened. And then if you get screened at 65, it's almost like it's easier now to start to make these changes than when 65 happens, right?
Right. So it's that whole proactive instead of reactive approach to medical care. And so we can catch some of these things sooner. Mm-hmm. You can start implementing changes and weight bearing exercises and even jump therapy, and making sure certain minerals are optimized in your nutrition, potentially in supplements that are important for bone formation and maintenance.
So it does a big screening for bone density, sort of, but it can give you a red flag if you need to go further. And then what else does it test?
So it's pretty fascinating. So you get this image of yourself. Can I hold this up?
Yes, you can.
This is image of yourself. This is a press
Which, by the way, my spine, I have scoliosis, and oh my gosh, that was just weird to see. But anyway.
Yeah, but it gives you this picture, right? So we're able to look at your bone, your body fat, your muscle. And those are the things that we're measuring. So we can see your bone mineral density, we can see your body fat composition, and then we can see your muscle mass. And so we're looking to see where you line up to a young, healthy person, but then it gives you a percentile for your age match as well. So you kind of know where you're landing in the scheme of other adults your age. Everyone kind of gets hung up on the body fat percentage as a great measurement. However,